My name is Rick. I'm an exercise physiologist, and my interest is in helping veterans and military in all aspects of health and physiology. In this presentation, I'll go through the Phase 1 education for our cardiac rehab program. Remember, heart disease is the leading killer in the United States, and this information can help. Cardiac rehab is the best way to get back to your life the way it was before your traumatic event happened, so let's get started. So what is the heart? It's the muscle that pumps the blood received from the veins, returning deoxygenated blood into the arteries, the outgoing oxygenated blood throughout the body. The heart is positioned in the chest, behind the sternum, the breastbone, and in front of the trachea, esophagus, aorta, and above the diaphragm. So this is the main organ that maintains your life. It should be taken care of at all times. I'll go over how in a minute. What is coronary artery disease? It's a buildup of plaque in the heart's arteries, also called coronary heart disease. It's a chronic narrowing of the coronary arteries over time that limits the blood supply to the heart muscle. The risk factors include high LDL, high blood pressure, family history, diabetes, smoking, postmenopausal women, and men over 45. Obesity has complications relating to the health and may eventually lead to heart disease and coronary artery buildup. Other factors like smoking, as previously mentioned, and extra alcohol consumption only contribute to the added problem for this disease. Common heart procedure and surgery are angioplasty and stent. Angioplasty is percutaneous coronary intervention, PCI. Balloon angioplasty, coronary artery balloon dilation. Stent is a wire mesh tube used to prop open the artery during angioplasty, filling and stays in the artery permanently. Another common surgery is coronary artery bypass graft. It's when a blockage can't be fixed by a stent. The coronary artery is too clogged and the cardiologist has to bypass the affected area where the blood supply was cut off. They sometimes take a vein or artery out of the arm or leg and attach it to the aorta to get a fresh oxygenated blood supply and attach it past the area where the blockages occurred. Another common coronary bypass is called a Lima graft. The cardiologist uses an artery that is already attached to the aorta in the left internal mammary artery of the patient's chest to bypass the blocked section. This one tends to be more common because they use the artery that is already in the area and are just relocating its flow. Living with heart disease can be a struggle, but some things you can do to make it better for you are taking your medications as prescribed, reducing your salt intake, exercising regularly, and go on more walks. Check your weight daily and maintain your logbook. Most of all, starting cardiac rehabilitation ASAP. By keeping up with your health metrics, you can adjust and plan out your day going forward. Since you had a cardiac event, you'll unfortunately be on some form of medication for the rest of your life. Some meds are more invasive than others and could create stiffness and other physiological complications like with the male reproductive systems. So keeping track of your medications is very important. Maintaining dose requirements. Ask your pharmacist for a Mediset weekly pill box so you can keep track of all the rest of your meds throughout the week and in the AM and PM. Do not skip any doses, even if you feel great. Talk to your doctor before discontinuing medication or if you think you're having side effects. Make sure you order new medications before they run out and plan ahead, put it on your calendar. Even if you're going to be away from the house during your dose, then bring it with you. So one thing you can do to reduce your meds is exercise regularly and then eventually end up having a chance to go talk to your cardiologist. I'll go over the benefits of cardiovascular exercise and resistance training in length in another video. Salt isn't going to do you any favors if you had a heart failure or a recent cardiovascular event. Limiting processed foods, soups, and sauces usually end up having higher sodium levels, so you want to not have too much salt in your body, and it'll hold in water and increase your weight. So avoid salty meats like from deli, sausage, ham, or bacon. So try to look for lower sodium options and eat more fruits and vegetables as well as whole grains. Being more aware of what food labels say can give you an advantage to take control of your dietary needs. So being conscious of food labels for what they say for serving sizes for the package can be misleading. Make sure the foods you eat do not have higher sodium content. An attempt to keep your sodium intake to 140 milligrams or less a serving. That'll be great. And if you have diabetes, then reduced sugar will be your identifier as well. And something else to keep track of and find. And make sure your label does not have the added sugars and then you don't want to end up having an increase in those. If you're smoking and all you're doing is digging yourself an early grave, the sooner you'll stop, the better off you'll be. And if you stop, and good for you, I applaud you. Smoking increases your risk of death, cancer, breathing issues considerably. Smoking causes about 90% of all cancer deaths. More than 10 times as many Americans have died from smoking than all wars fought by the United States. Oh, and here are a few reasons why you should stop smoking. Reduce your risk for cancer, lower your blood pressure and cholesterol, reduce stress and improve your mental health, boost the effectiveness of some anxiety and depression medications, make it easier to stop using drugs or alcohol, increases your energy, improve your lung function, skin and night vision, strengthens your immune system, muscles in your bones, help you manage HIV and other chronic health conditions, decreases risk for many types of cancers, including lung, pancreatic, kidney, stomach, bladder, as well as cancers of the blood, throat, and your mouth. It increases the effectiveness of medications for depression, anxiety, and psychotic disorders, and also decreases your risk for erectile dysfunction. Low or moderate alcohol consumption isn't going to do much for you on the short term if you're healthy. If you recently had a cardiac event, then alcohol probably needs to be the furthest thing from your mind like smoking. Not to say that you won't be able to have a drink or a glass of beer or wine again, but it's not going to be beneficial during your rehabilitation recovery period. So alcohol reduction, alcohol is the most abused substance among veterans. Alcohol can lead to chronic kidney and liver issues. Chronic alcohol can go and impact relationships with family and friends. And chronic alcohol use may cause cardiomyopathies or heart muscle diseases that enlarge, thickens, and or stiffens the heart, or loses the ability to pump blood efficiently. I know it can be hard, high percentage of veterans use it, and sadly, many abuse it. Diabetes is another aspect to be worried about. It takes a toll on the inside of your vessels and your body. Hemoglobin A1C, trying to get less than 7 or 8. Calorie reduction with physical activity. LDL, less than 100 milligrams. DL, triglycerides, lower than 150 milligrams per DL. BP, lower than 130 over 80. HG, diabetes self-management education. Get a dietitian referral. And complete smoking cessation if applicable. Again, physical activity will help mitigate the disease by increasing cardiovascular activity and resistance training. Lipids are your cholesterol levels. HDL is the good one. You should try to keep elevated. LDL is the bad one you want to try to keep down. If you had a cardiac event or heart failure, then you're going to want to keep your LDL lower than if you were healthy. LDL less than 70 for very high risk for heart disease. LDL less than 100 for high-risk patients with multiple heart attacks or diabetes. LDL less than 130 or otherwise. If LDL is chronically high, then a statin may be recommended. Total triglycerides values should be less than 150. Reducing blood pressure is easier said than done, but there's some ways that you can help it. And try to increase your fruit and vegetable intake, reduce your high saturated fat, cholesterol foods, have more whole grains, fish, and poultry in your diet. Lower the number of processed foods, salt, sugar, caffeine, alcohol, and red meat. Go on for walks after every meal, and drink more water. And if you had a heart attack or in the hospital and are on diuretics to have fluid drained from you, then more water may not be the answer. Blood pressure goals. So this chart can be found in American Heart Association's website. Want to try to be in the normal range all the time, but when a cardiac event occurs, it may not be possible without medications. And if you were diagnosed with hypertension, then your blood pressure will be elevated. Fortunately for you, increasing exercise activity can help lower it. BMI, or body mass index, is a method based on height and weight of an individual for determining health risk factors. The higher your BMI, the more at risk an individual is for contracting illness and disease. Two tried and true methods for counteracting high BMI is more exercise activity, being conscious of what you put in your body. You want to eat less than what your activity level is to lose weight. Increasing your activity is a surefire way to help your body. It helps circulate blood. It aids in bringing oxygen to the tissues. It helps in using stored energy. Increases your metabolism. Lowers stress by increasing endorphins. And it allows you to do more activities you would not be able to do. Your activity should be progressive and steadily increasing as time goes on. So something you want to try to do is sit less, move more often, and try standing as much as you can. Aerobic and cardiovascular exercise, strive for 30 to 60 minutes a day, 5 or more times per week. And also for resistance or strength training, try for medium or vigorous effort. RPE, or rate of perceived exertion, is a useful tool to gauge your activity level while performing exercise. The effort you exert while you perform an activity is what this method is based off of. So a 6 to 9 is something that you can do all day that requires little effort. You know how you feel when you're lying in bed, sitting around in a chair, or a little bit of relaxed. Start out when you work in to get a warm up in. Start out at a 10 or 11 until you get your routine down. A 12 to 13 is when you're getting comfortable in your workout program. A 14 to 16 is where you're working up to your phase 3 after the phase 2 cardiovascular workouts. And you want to try to avoid 17 to 20 as much as you can, and that may lead to other further complications. It's also the hardest, and we don't ever want you to work in that zone at all. Cardiovascular and resistance training are your best friends. Remember to start off slow and don't overdo it. For the next couple slides, I'm going to go over the FIT VP principle and SMART goals. These are useful tools to set yourself up for success. So the FIT VP is frequency, intensity, time, type, volume, and progression. So frequency is how often you perform an activity. Intensity is how hard you are working during your activity. The time is how long you are working during your activity. The type is how purposeful is your exercise activity. The VP is volume, so what is the total weight that you lifted. And progression is how challenging is your program or the exercise that you are performing. Goals is a great tool to give you direction. They're the way to guide you to where you want to go. So it's an acronym specific. Keep your goal to something that you want to accomplish. Make it measurable to keep track of your progress. Attainable. You don't want to make your goal too lofty or far out of reach. You want to make it relevant to you. Make a goal that aligns with your values and what you want to do. And make it time bound. Have a realistic end date to provide focus and give you motivation. So setting up a goal will help motivate you and keep you on track for where you want to go. Depending on the area that you live in, cardiac rehab may be in high demand, and some facilities may have a really long wait list for you to begin. There are more hospitals that have started to incorporate home-based cardiac rehab so the patient's recovery can happen sooner. Home-based cardiac rehabilitation is also better for those that live in a rural area outside the city limits. Facility-based rehab requires a 12-week commitment by physically going to a center 2 to 3 days a week. In-home basis, where an EP meets with the patient virtually and engages in educational and exercise activity in much the same way in the comfort of the patient's own home. The facility-based takes more time, but you're physically performing supervised workouts under an EP. And the home-based workouts you can complete the same way. You just meet with the EP one time a week. If you made it this far, then I'd really appreciate it. This information was gathered from the American Heart Association, AACVPR, and ACSM. And the next video will be geared toward physicians and how and why exercise should be recommended just as much as medications to save your patient's life. So don't forget to subscribe, smash that like button. See you next time.